Let's take a look at some not so surprising statistics about men's health. It's no secret that men aren't always the best at taking care of themselves. Last year, as part of their national Mention It campaign, the Cleveland Clinic surveyed more than 500 men ages 18 to 70 across the United States and found that only 3 in 5 men get an annual physical, and that just over 40% go to the doctor only when they fear they have a serious medical condition. Over half the men surveyed said that their health just isn't something they talk about. Men are much more likely to discuss current events, sports, or their job rather than their health with their male friends. When men do discuss their health, they brag about hero injuries or wait until they've had a close call before they say something, while below-the-belt issues are rarely, if ever, discussed. For those men who did manage to make it to the doctor's office, survey respondents said it was only to stop a loved one from nagging them. With such a cavalier attitude towards health, do men fear anything at all? Well, yes, according to the survey data. The number one thing men worry about most is preventing a heart attack. Dr. Nitza Alvarez, cardiologist at Tri-County Heart Institute, tells us what every man needs to know about preventing heart problems.
Cardiovascular disease in men start early in their lives, and you don't have to have symptoms to have cardiovascular disease, and that is something that I want to emphasize here. Men, they can be young, they can feel good, they can feel healthy, but that doesn't necessarily mean they don't have cardiovascular disease. So how do you know you're a risk, and how do you know you need to seek attention or get screened perhaps? So number one, we start with how old are you? You know, we use age. We know that men older than 45 have a higher risk of having cardiovascular disease than men at younger age, except for those patients that might have very strong family history. Then we'll look at your family history. Ask yourself, do you have a dad, a mom, a grandfather who had heart disease, especially at a young age? Were they young when they had the heart disease? Perhaps we're looking for dad or a brother or an uncle or a grandfather that had an event younger than age of 55. So family history is also very important. Do you have high blood pressure? Do you have high cholesterol? Sometimes it's hard and they might say no. You'll be surprised how many times we get patients that have said, do you have high blood pressure? No. I'm like, well, your blood pressure is high. If you don't see a doctor, you might not know. Do I have diabetes or not? What is my sugar levels? We know diabetes is a high risk for cardiovascular disease as well. So tips that I can give you. If you don't know if you're at risk for cardiovascular disease, think about how old are you, how much do you weigh? You know, when was the last time you saw a doctor? Do you know your cholesterol numbers? If you answer to any of those are in any way similar to what I just described for risk factor for cardiovascular disease, go for your checkup. A checkup a year can save your life. And don't think that because you don't have symptoms, that might not be something that can be developing.
Tri-County Heart Institute patients know what it means to grapple with affairs of the heart. Heart patient Nick Miola talks to us about the importance of having quality care.
I've been in and out of hospitals since I was 40 years old, so I've seen a lot of doctors, but I've recently had another heart attack, and my heart is failing kind of bad. Right now, I feel very good, but my life is like a sine wave. You know, I have very, very good days. I have kind of some bad days. But if anybody's going to keep me out of trouble, it's going to be Dr. Alvarez. She cares. First time I ever saw her, I was in the hospital. I was in for one of my many, many bouts of congestive heart failure. And she came in and told me that they wanted to put me on a lifelong drug treatment, drug infusion. So that's how I first met her in the hospital room. And I have to say this, I believe from the instant I saw her, God sent me a guardian angel to protect me, because I was not supposed to live long. And in my opinion, she's kept me alive for at least 6 years. I think Dr. Alvarez is an excellent doctor. I think she is the most compassionate person that I've ever met in my entire life. And her love for her patients is just unbelievable. Every time you see her, she greets you with a hug. It's like you are her only patient. you're in the hospital. She comes in, she sits on the side of your bed and talks to you like she's a member of your family. I can't believe the quality of doctor she is. I tell everybody about her.
You'll find information for Dr. Nitza Alvarez and the Tri-County Heart Institute when you click the Men's Heart Health Story link icon online at yourhometownhealth.com.